been 1 year since the first Americans received FDA-authorized COVID-19 vaccines. And the 1 year mark comes as the U.S. passes 50 million COVID-19 cases and 800,000 have died as a result of the virus. Joining us now to discuss the latest is infectious disease physician Dr. Patel. Thank you so much for joining us from the University of Michigan. We appreciate your time. Dr. Patel, what does the uptick in recent COVID cases say about the pandemic 1 year after rolling out these vaccines?
I know. I remember exactly 1 year ago because I was one of the lucky folks to get my name drawn out of a hat. And 1 year ago, I was also working in the hospital inpatient on infectious disease consults. And at that time, really the whole nation, I think, felt really optimistic. A lot of the people who got their vaccines early, were very, very confident. And it's hard to believe that a year later, we're still in the hospital seeing tons of patients that are getting admitted with COVID, and mostly at this moment, still with Delta variant. So I think there is concern going into the holiday season that we're hearing about what's happening in England and internationally. And, it's most worrisome for the folks who haven't gotten vaccinated yet.
So, Dr. Patel, there was kind of mixed messaging out there where, on one hand, they were saying, well, there'll be more variants coming. And then there was the other hand where people were saying, it's the vaccines. We're free. We're going back to normal. But I think now Omicron has really made people realize, hey, this is not going away. Is this just going to be a part of our lives moving forward, having to deal with these different strains and different outbreaks?
Nothing has been predictable, right, since the pandemic started. I will say that, one thing that I think is continues to be true is that it's kind of amazing in such a short amount of time that scientists were able to work with the federal government, work internationally to put together a number of effective vaccines. And every variant that we've seen so far, the vaccines continue to hold up against the things that we worry most about, right? And that is hospitalization and death. Even the recent study that came out from South Africa shows that even though it affects the efficacy of against hospitalization and death a little bit, it's not as much. And so that I would take to mean that the vaccines continue to work well. And we're learning more as we go into the pandemic. But at this moment, we know that most Americans should get boosted. So if you're on the, not sure if you want to get the booster, I would say the best thing to do to kind of protect yourself going into the holiday season and your family is to get everyone vaccinated and everyone boosted as possible.
Yeah, absolutely. We want everybody to stay safe. And though cases are on the rise, Dr. Patel, we're not back to the numbers from last year, as you know. So is that an indication that both the vaccine and the mandates are working?
I mean, I would really take it as so. And, unfortunately, most of the folks that we are seeing in the hospital that are coming in with COVID are primarily unvaccinated. And so that, those numbers just go to show that those of us who had the vaccine starting a year ago, and now that's more than half of Americans, are really the vaccines are doing what they were intended to do: keep us out of the hospital, keep us out from getting to the ICU, intubated, getting sick, being in the hospital for a couple of months. And that's what we want. What we really want is to treat these other folks and get them out of the hospital so that we can go back to regular business for all these people who actually need to be in the hospital for other reasons.
All right. Well, thank you for that update. We appreciate it. Dr. Patel, infectious disease specialist from the University of Michigan. Always a pleasure having you here on BNC.